Diagnosis of hypothyroidism. Hypothyroidism is one of the important cause of growth failure, mental retardation, and other multiple organ involvement. So they have been detected by the neonatal screening at day 5 or so. It's a must. When you don't do it, or it is not being done, the how they are being detected. The your anterior fontanelle and posterior fontanelle, you know that they are closed by 6 months and 18 months respectively. When these things doesn't occur, this is one of the important cause over here. Apart from that, where these children have the developmental regression or retardation, miles are delayed social smile, yeah, they are not in the 6 months 6 weeks, and so the neck control is not at 3 months, child is not sitting at 6 months, not crawling at 9 months, and not standing at 11 months, and not walking by 12 or 14 months or so. So these things are being delayed. These children has decreased basal metabolic rate, so they are a little bit hypotonic. They have less interest in the surroundings. They have poor brain growth, so they have sleep more, and they have no fat deposition. Fat are not being wasted or not being consumed, and thereby the tongue is large a little bit. They are little. That's why they're apneic at times. They have hypokinesia or bradykinesia. They have cardiomegaly, and your airway obstruction, little bit distress, and your abdominal distension due to hypotonia, and your skin is cold, mottled because of the low BMR. And if you measure these children, the upper segment, lower segment, 1.7 is to 1 at birth, 1.4 is to 1 at 11 years, and in adult 1 is to 1. So they are infantile, they remain tall upper segments. And then how do you investigate? Investigation basically is one: THA is elevation, thyroid stimulating hormone. T4 is a reduction, and T3 reduction. Basically, THS elevation is compensatory to low thyroxine and triiodothyronine. Other evidences of hypothyroidism, they are done only in the clinical and not in the academic interest. If you scan the thyroid, you will have less amount of thyroid tissue. If you do the other investigations, your they you'll have the multiple foci of your bone, suppose bone X-ray, multiple foci of ossification. What do you call it? Epiphyseal dysgenesis in the beaking of the thoracic 12 and lumbar 1 and 2 vertebra. You have increased cellular size and Wormian bones in the intersutural bones, etc. And your how do you treat? You treat thyroxine lifelong. Initial dose may be high, 10 to 15, and afterwards it is 3 to 6 microgram per kg. Total dose will not exceed the adult dose. Usually half to one tablet daily, 50 microgram tablet for almost for lifelong. Autoimmune hypothyroiditis and other diseases, they are not common in the pediatric age group. By far the common is thyroid hypoplasia, dysplasia, agenesis, dysgenesis.